After one storytelling workshop, a physician tried something different with a patient who had been refusing a tetanus vaccine. 1 week later, that patient got the shot. My guest has spent years helping healthcare and public health professionals unlock that kind of impact, and she's sharing the frameworks that make it possible. Listen in to hear why storytelling is a skill every health professional needs, how to move from individual stories to population-level data, and what it takes to start practicing today. You're listening to the PHEC podcast, episode 459. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to their community partners, as well as the broader communities they serve. Now, the support we provide, in addition to data analysis, it often falls in a category of strategic planning and sometimes capacity building. It just depends upon the needs of the organization. So please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. The links will also be provided in the show notes. I am very excited to introduce you to my guest on this episode. Now, her name is Dr. Sally Perkins, and she's a storytelling expert and director of storytelling at a healthcare conversation intelligence company, which is fascinating all by itself. Her team transforms recorded patient conversations into compelling narratives that drive change inside health organizations. She talks about that during our conversation, so you'll get to learn a little bit more detail. This conversation grew out of our ongoing What is Public Health series and the realization that many of us struggle to explain our work in plain language. So we invited an expert on to help us with that. We cover how to build story that moves people to act, how to connect individual experiences to population-level data, and how to use simple frameworks that even busy professionals can put to work right away. You'll leave this episode with tools you can use immediately. Let's connect my conversation with Dr. Perkins right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Hi, Sally. Welcome to the podcast.
Thank you. It's an honor to be here. I'm thrilled.
Yes, I've been looking forward to this conversation for quite a while. I reached out to you, actually had a meeting ahead of time. This has been a whole very strategic move. In fact, we've been hosting the series on the podcast, What is Public Health? And I invite our guests to come on and explain public health in plain language. And then also I ask them to, share stories. And the goal is for us to be able to comfortably and easily explain what we do to our friends and family, to the community of folks that we serve that are not public health professionals, in a way that they really understand and they can become advocates for public health. And, so often the work that we do when it's working well is silent in the background. And that doesn't mean that we don't need to sell it and promote it. We need to really make sure that people understand and value what we do. So through storytelling, through plain language conversations, that was the drive. And I quickly realized that, we're really not good at storytelling. A lot of us, we'd like to be, we want to be able to break the silos and talk without the jargon. So the plain language part of it is one aspect, and then being able to share stories, because some people do it really well. And I think it lands and it resonates and people remember a good story. So I asked Laura, my assistant, I said, can you please find us a good storyteller that can come on the podcast and help teach us in public health about storytelling? So she went to work and found you on LinkedIn, and then you and I met. I thought you were perfect for this podcast. So a long road. You've been sought after, Sally.
Well, I'm delighted to have been found.
Yes, I am really thrilled here. So let's take a few moments and give the audience a chance to get to know you. So why don't you introduce yourself and tell us a little bit about who you are and what you do?
Yes, my name is Sally Perkins, and the quick story of how I got to where I am now doing work in healthcare with storytelling is that my career started in academia. I was in rhetoric and communication, had 12 solid years in academia. And then life evolved, life changed. And in the course of some of those changes over the coming years, an unexpected happy accident happened for me, which is that I stumbled into the art of storytelling. I live in Indiana, and we have an organization in Indianapolis called Storytelling Arts of Indiana. It's the only storytelling organization of its kind. So I stumbled into that, and I started literally volunteering, telling stories by the bedsides of kids at a local children's hospital in Indianapolis. And then that led to the beginning of a career in storytelling performance. And as I was doing more and more performance work for adults, not to children mostly, but primarily for adults, those adults would come up to me afterwards and say, I think our organization needs the skill that you have. Can you help us in some way? So then I began working with lots of different organizations, for-profit, not-for-profit, government organizations, all kinds of different entities, to help them learn how to craft their stories in ways that would be compelling for whatever their persuasive purposes were. In the midst of that, I happened to have the good fortune of starting to connect with a number of healthcare entities. So, for example, I started doing storytelling workshops for part of the Kentucky Physician Leadership Institute, in which they were grooming physicians in the state of Kentucky for not only how to be more effective with their patients, but also with their offices, and how to be public advocates for health issues. And so I started doing storytelling training with them, training them on how to tell stories, not only for persuasive matters with patients, but also for public advocacy. That then snowballed into many other kinds of health-related kinds of consulting and training that I would do. I've worked a lot with vaccination advocacy groups who are seeking to try to persuade with their stories about the importance of vaccinations, among other kinds of issues. And then all of that ultimately has led me also to my day job. I work for Authentics, which is a tech company here in Indianapolis. And we are a conversation intelligence platform. So we take recorded conversations in the healthcare space. So when patients, for example, are calling the manufacturer of a medication, or when they are calling their payer or their provider, and those calls are being recorded, we are taking in those calls. We're using both AI and humans to turn those messy conversations into structured data, because those conversations are filled with unsolicited feedback that patients and caregivers are giving to healthcare entities. And when that data is structured and we can then tell the stories of those patients and caregivers in that data, we are able to help healthcare leaders in those organizations drive change. So I'm the director of storytelling at Authentics, and I lead a team of storytellers who literally dive into that data and craft and tell compelling stories to the leaders of those entities. That's my short, condensed version of many years of work in this space.
Oh, thank you for that. And it's fascinating because there's just so many layers here. There's the technology side and this very innovative way of using AI and storytelling in advancing health. I really appreciate that work. And then also how you're supporting and serving in these groups that are really trying to become better storytellers, the physicians. And here you've got a whole group of public health professionals who are really interested in ways to improve our skills and how we tell our story and to break away from some of the jargon that sometimes is difficult to break away from, but we really want to be able to do better with that. So I'm excited to have you here as a resource. Now, you have a book that you've written that I have right here. So if you're watching this video, I'm holding the book up. Can't really see the copy that well, but tell us about your book and why did you decide to write this book? And for spoiler alert, don't worry if you're listening and trying to write it down. I'm going to have links to it in the show notes, but please tell me about the book.
The book is called From Story to Action. It just came out last fall. And I will tell you that my greatest inspiration for the book was the fact that I was driving home, literally, from one of those Physician Leadership Institute seminars. And at the seminar, I learned that one of the previous year's participants, a physician, had been in the workshop learning about storytelling. And we were talking about different types of stories that you might tell to a patient, which would be different than stories that you might tell to the legislature, for example. And one of the stories that we talked about was a vaccination story. And she was thinking the whole time about a patient she had who she was struggling to convince to get a tetanus vaccination. I happened to share a story about a tetanus vaccination situation in the workshop. And then all the participants, the physicians, were all doing work on figuring out how they could tell stories. And I had gotten a message the following year that doctor went back and a week later saw the patient and said, I told him a story. He got the shot. And so as I was driving home from the workshop, I was thinking to myself, this resonates. I've got some very simple yet powerful frameworks in the book that both help people know how to tell a compelling story that I would call a tree tale that talks about individuals and individual experiences in particular points in time, but also frameworks that help physicians zoom out to tell stories about the aggregate of populations, because sometimes we need to use data in our storytelling to persuade particular audiences. And what I found was that year after year, these physicians and others that I was working with were finding that the frameworks were so simple to use, yet so helpful to them that then they were taking them and putting them into action and finding themselves more confident as they were trying to tell stories, and they were seeing the impact. So as I was driving home that day, I thought to myself, there are so many storytelling books out there. I fought this for a long time. The world doesn't need one more book on the shelf about storytelling. But then I thought people are finding value in these frameworks. And if I were to get hit by a bus, God forbid, I would kind of like these things to live on because they are proving to be so fruitful for people.
Yeah, I'm really glad you explained that. It says, from story to action, transform your storytelling to win support and ignite change. Love that. Like I said, we're going to have links to this in the show notes so people can get a copy. And I really encourage you to do so. There's so much that as I just skimmed through, I just recently got my copy and I am excited to dive into it. And I know I'll be referring back to it even on this podcast. So I'm looking forward to how I can read through and implement some of this. Sally, would you mind taking a little bit of time on this episode and maybe sharing a few things that for people who are listening to the podcast maybe could take away and be able to put to use, in the context of either being able to plain language or just starting with storytelling or, what do we need to know that we don't know about storytelling?
Absolutely. Four quick things come to mind. The first thing, which you can read in much more depth about in the book, the first thing is that my frameworks are based on what neuroscience has been teaching us as of late about the power of storytelling. So we did not know until about 10 or 15 years ago exactly what was happening in the human brain when people encounter a story and how that differs from what happens in the human brain when people encounter data or facts. So you think about how much public advocacy we're communicating data, important data, and we're communicating facts to people. Yet what we've learned from neuroscience is that that data and those facts activate limited parts of the human brain. When people encounter a story, we now know that multiple parts of the human brain are literally activated. It's like they light up inside of us. And more importantly, what the neuroscientists have discovered that they did not anticipate was that the same parts of the brain that are used to make decisions are what are activated when people encounter a story. So neuroscientists, among like most common thinkers, used to assume that only the prefrontal cortex, the executive function of the brain, was what was engaged in complex decision making. And they've since learned that that is not true at all, that people are using all parts of their brain to make decisions. And those happen to coincide with the parts of the brain that are activated when we tell stories. So what does that tell us? We can't afford not to tell stories. That's number one.
That's fascinating. Like when you say we can't afford not to tell stories, that really puts it in a whole different perspective.
It does, right? Because people are making decisions and our brains need to sync with theirs. Now, that doesn't mean that we don't use data. So what I've come to recognize in my work with all kinds of groups, and especially in my day job, is that this does not mean that data and storytelling are two separate things. So what do I mean by that? There's a story structure that I think is so simple and so useful, and it looks like a loop. And the idea is that stories start out with normal. Once upon a time in a land far away, there was a king, a queen, and a princess. Normal, right? Nothing is awry. But a story isn't interesting if it stays normal. Something has to go south. So if you think about a loop, right, we start with normal and then things go south. Something goes wrong. And that's what makes the story interesting. At some point, there must be some sort of an intervention, right? We have the fairy godfather who comes along after something goes wrong for the princess or king and queen, whatever it is, that ultimately takes us to a new normal. It's in the book. It's a very simple visual framework. But what happens is when people encounter that framework, they suddenly realize where their storytelling has gone wrong, that we're often inclined to start with the uh-oh or the problem, or we're inclined to start with the new normal, various things that if we can structure it using that story framework, we can do two types of stories. So now I'm on to item number 3 and 4. Right. So item number 1 is what we know from neuroscience. Item number 2 is this story loop structure. It's critical to knowing that we are in a story as opposed to just giving organized information. So when we're using that story loop, we're in a story. Then number 3, we need to think about different types of stories. So number 3, one type that can be very impactful is what I would call a tree tale. As I mentioned a moment ago, a tree tale zooms in to tell the story of particular people at specific moments in time. For example, a moment ago, I was telling you about me driving home from this workshop, right? So all of a sudden, I'm a character, and you can see that happening. There's a context for it. And I tell you a little bit about this physician who had this one patient. I didn't elaborate on it, but it was a specific moment in time. And so a tree tale zooms in to talk about that. And what's powerful about it is that if we identify with those characters, we connect to the story. And if those characters are struggling with something that we identify with, we are more likely to be persuaded by that story. And so a well-told story may be a tree tale about specific people who are experiencing some sort of health issue, a public health issue, but we're talking about individuals and we tell their story. Number 4, however, often, depending on our audience, we have to zoom out and tell a forest story, not a tree tale. And the forest story uses that same story loop structure, starting with normal, then we have a problem, then we have intervention to a new normal, that same structure, but it's zooming out to tell the story of the aggregate. So it might be the people in our county, the people in our state, the people in our nation, the people of a particular demographic, right? And it zooms out and it may very well incorporate data. But the data aren't just provided in a linear fashion or just shotgun all kinds of data thrown at people. The data are very strategically woven in the shape of the story, which again, it's suddenly people that I work with recognize, oh, I didn't have to include all of that data. This is telling me strategically which data points need to be included. And then the most powerful thing that can happen is when we can weave together a tree tale and a forest story. So in my day job, for example, we take in all of these conversations. We might be telling a forest story about 40,000 conversations in a data set. So we might tell the right, indicates how many people are experiencing a fulfillment barrier in their effort to try to get onto a high-cost medication. So we've got data around that. We show where people statistically are getting stuck in their patient journey. And when we tell those stories, our clients listen and they nod and they're curious. But then we strategically weave in an audio montage with clips of specific individuals telling what their experience is. It's like we go from the forest into the trees. And the moment our clients hear those voices and are locked into those tree tales, I will tell you, it's magic. The motivation to make some sort of a difference skyrockets. It might be there from the numbers, but it skyrockets when we go from the forest to the trees and then back out to the forest so we understand this in perspective. So you see, our clients are never going to make, nor should they make a decision based on a few tree tales alone. But when it's strategically woven into the aggregate of the forest story, that's where the magic happens.
That's fascinating. Do you happen to have an example that you could share of a story that demonstrates either one of these steps, but I'm especially interested in one that does like the tree tale to the forest?
Yeah, absolutely. In fact, this is one I'm going to share with a group of physicians this evening in a webinar that I'm going to do. So we'll go back to the vaccination story. This was, in fact, the vaccination story that I shared with the physicians before, and then I'll show how we can weave that into a forest story.
I think that's a great example just because that's a perfect example of vaccines will overlap public health and healthcare. And I think as a public health community, this is a very timely conversation and challenge right now across healthcare and public health. So this is a great example to use to illustrate these points.
Great. Oh, good. I'm glad it's a good fit. Okay, so an example, the tree tale would be, for example, a story about a little boy 6 years old back in 2017 in the state of Oregon. And he was on his family farm where he fell and cut his forehead in the barn. And his parents did the sutures themselves. But it wasn't long before he started showing some symptoms. And he got sicker and sicker. And so they took him, eventually he had to go be hospitalized. And he was reacting with tetanus. He'd never had a tetanus vaccine. The hospital had not seen a tetanus case in years. But here was this little boy, and his parents had been opposed to vaccinations, so he'd not had any vaccinations. And he got so ill. So he was in the ICU for, I believe, 47 of the 53 days. And then he had to be in rehab for another 17 days. He recovered, and at the cost of $800,000 plus. And we would hope that the story would have ended with his parents vaccinating him. The story ends with them still choosing not to vaccinate. Now, there is a tree tale specific story. And in fact, this is the one that the physician was able to tell her patient. And the patient said, give me the vaccination. Now, that is a tree tale, but in the aggregate, somebody who's advocating to an audience who demands the data may have to back up. And so an example that I use is with a school organization that is saying that so the story starts with back before the pandemic in 2017, they had a very high rate of students who were vaccinated. It was in the 90s pre-COVID. But then, COVID happens. And we all know that not only were there controversies around the COVID vaccine, but because children were no longer in school, the vaccination rates for all the vaccines for children started to decline. So we provide all the data around the decrease in the vaccination rates. There's also data then around increase of absences. And we see that, for example, with the measles, and we can provide the data around what that means for absences. And then we can provide the data for what that means for academic performance as well. And then at that point, it's appropriate to bring in a tree tale, perhaps, that illustrates that, about a child who, for example, did not get a measles vaccine and then was out of school, and what that meant for all of those children in that classroom, right? And so we zoom into those particular children. Then we provide the intervention in the story, which our goal is to achieve 100% vaccination rate, but we're going to have a campaign, and the campaign is going to have to require the following kinds of actions from teachers, from school nurses, from administrators, and how we're going to outreach to parents and how we're going to talk to parents about the vaccination rate. And then this is a fourth story that would be kind of what I would call an unfinished story, where the ending would be a projection of what we hope the future will look like if we can raise the vaccination rate with the program that's being launched to run the campaign to get more and more parents to get their children up to date on their vaccinations. So there's an example of how the aggregate has to pull in the data, still using the story structure. Notice that it starts with, everything was fine in 2017. That's not a story. The story is, but then COVID hit, and we saw the decrease and the decrease and the decrease and the decrease. And so now we've got to do something different.
Fascinating. So this takes practice, right? This is a great example, and thank you for sharing that. And I'm thinking about, as I read through the book, I'm going to be able to understand some of these steps or some of these, like using the frameworks. And then it's a matter of practicing, I would imagine. Practice makes perfect. But does it take a long time for people who are just starting to become aware and just starting to learn these frameworks to put it into practice?
Practice makes perfect. Practice certainly makes us better. People will get more or less comfortable over time, but it does not take a long time. In fact, I have a former colleague of mine who was terrified of doing the kind of storytelling that we do at Authentics. And he finally said to me, will you give me an hour of your time and tell me how I can do this better? I taught him two things. Number one, I taught him that story loop. And so all of a sudden, he had a way to frame everything. And he literally kept that loop on a sticky note on his monitor. And then he knew, it's like, oh yes, okay, that tells me how to order this. So I know it's going to be a compelling story, and I can visualize it in my mind so much easier through that loop framework. The second thing that I taught him was about narrative transitions, which means being able to connect things in the story. So a story isn't just connected with the word and. once upon a time, there was a king, a queen, and a princess, and they went to lunch every day at the pond, and a frog leapt out of the pond. It's connected by language like there was a king, a queen, a princess, they went to the pond, but then one day. That is a narrative transition that tells us we're in a story, not just and more information. So when we're in a story, we hear words like, but then one day, or but then COVID hit. Signal, we're in a story. Also, the language of narrative transitions indicates things like this happened. Worse yet, this happened. Worse yet, this happened, right? So students started getting measles. Not only were they getting measles, but that meant that they were, worse yet, missing a lot of school. And that meant that we started to see a decline in their academic performance. So the language of narrative transitions takes an audience from just, okay, it's some information, and it pulls them along through the story to make them need to know how this is going to end. So, does it take a lot? It just takes some simple tools. Certainly, practicing makes it easier depending on whether you're telling the story orally or whether you are presenting the story in writing. Absolutely, practice will help, but there are things that can be done immediately that will make a difference. So my colleague who learned this in an hour was transformed at the next time he went to tell one of these data-backed stories. Completely transformed.
Yeah, that's amazing. Thank you so much for going through those examples and for teaching and diving into that. As we begin to wrap up, because I'm going to be cognizant of time, I want you to, now we're going to provide links to connect with you on the show notes page, but I know that this book that we've referenced is a great resource for anyone listening. So from student up to career professional, senior level professional, anyone can order this book and read through and learn and apply what they're learning through the book. So that is a great resource for everyone. But also for organizations who may be listening and thinking that they could use services at a different level where you come in and help with the organization. Is that something that you are able to also do?
It absolutely is. So I work with lots of different groups ranging depending on what their need is, all the way from a simple lunch and learn where you get a general exposure kind of like this to the tools, to a full day workshop where we're not only learning them, we're applying them. People are getting feedback. They're practicing them with one another, and they walk out with stories in hand and the tools in their back pocket and some practice underneath their belt.
I love that. So we'll make sure that, like I said, we have such a diverse audience of listeners. So if anyone is looking to bring you, work with you, talk to you about that opportunity in their workplace, in their organization, then we'll have that connection information and I encourage you to reach out to Sally and talk about what may be possible for your organization. And then individuals, I'm just encouraging you all to grab a copy of this book and dive in. Sally, thank you so much. This has been a wonderful conversation, and I'd like to leave the opportunity open for us to invite you back again. Maybe we can have another conversation, a future episode. I'd love to have you back if we can work that out.
Well, that would be my delight. It was not only a happy accident for me to land in storytelling, but so much more value was added to that for me when it landed in the healthcare space. And so I appreciate greatly what your audiences are doing. And if this tool can be of use to them, I'm so happy to be here and sharing it with you all.
Oh, that is absolutely wonderful. Thank you so much. And we will be in touch.
Thank you.
I really hope you enjoyed that conversation as much as we did. The gap between what public health professionals know and what the people around them understand is where storytelling does its most important work. This episode is a reminder that the story you tell about your work matters as much as the work itself. The frameworks my guests shared apply whether you're advocating for a patient, presenting to legislature, or explaining your job to a family member at dinner. Your expertise is the foundation. Storytelling is how you build the bridge, and that bridge is something anyone can learn to build. I encourage you to connect with Dr. Perkins and learn more about the great work that she's doing. And I also encourage you to grab a copy of her book, From Story to Action. You can find all of the links to connect with her, as well as links to purchase her book, on the show notes page. The show notes page for this episode, which is episode 459, can be found at phecpodcast.com. And once you're there, just navigate to episode 459 to find its show notes. One more thing before we go. Remember that our podcast has an app and a private community, and it is independent of social media platforms. This is a place where you can engage with public health professionals from around the world. And in addition to being a part of this amazing community, your membership supports the production of this podcast and episodes just like this one. You can download the PHEC Podcast Community app in your mobile app store, and it is available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.